We are here to talk about blood tests for metabolic disorders. You've probably heard me and so many other functional health practitioners talking lately about some studies that were done that says that 50, wait, no, what's the number? Well, initially it was 88% of the population is metabolically unwell. More recently, back in early 2022, the number has shot up to 93% of the population is metabolically unwell. And what people want to know from me all the time, I get this question, well, what does it mean? How do I know if I'm metabolically unwell? And so that's what we're going to talk about today. Just a few of the assessments, a few of the blood tests that you can do to see if that's the case. And I'll sneak in a few of the symptoms and whatnot. So, welcome back to the channel. I'm Dr. Rita Marie Loscalzo, and here we are to talk about how to keep you metabolically healthy, completely healthy, and thriving in this world versus barely surviving and looking to drugs and surgeries to kind of put all the pieces back together again. That's not the part that works. So, today we are going to talk about metabolic unwellness and some of the tests that you can do to confirm whether you are metabolically well or unwell. So, what does all that mean, this metabolic wellness? So, when the study was performed, we were looking at people who are in a state where there's certain parameters of metabolic health. So, what is metabolic health? Metabolic health is when our hormones and our uh, insulin levels, our blood sugar levels are all within balance, within normal realm. When you look at what the study was looking for in terms of symptoms and how the person was presenting, metabolic wellness means that you have a good waist chip ratio, right? It's below 1 for men and waist chip ratio, and below 0.87 for women, which means that your waist is smaller than your hips, right? For men, obviously the waist and hip sizes are supposed to be a lot closer. So that's one thing. I personally think it needs to be a little bit tighter than that, but that's one criteria. The other criteria is that your fasting insulin is under 100, okay, or 100 or less. That was the criteria for metabolic wellness. And then there were a few other criteria that, there was no insulin resistance diagnosed. You didn't have a history of diabetes or heart disease, etc. Sadly, so few people met that criteria. So today we're just going to talk about some other blood tests that you can get done on yourself. You can do on yourself, you can order on yourself, or you can have your doctor order to determine what's your state of metabolic health. So your metabolism is that set of interactions that happen in your body that keep you basically humming along and keep your body running well. And insulin is a super important one, and so is blood sugar. And sadly, so many people who have early stages of insulin resistance don't know it and don't even admit to it because they say, well, my mom had diabetes or my grandmother had diabetes, but I don't have diabetes. And they automatically associate metabolic wellness, insulin resistance, blood sugar balance with having diabetes or not having diabetes. But let me just shake your world a little bit here. Having diabetes is an end state of having a disordered metabolism for a very long time in general. So, how would you know if you're feeling metabolically unwell? How would you know if your blood sugars tend to be out of balance or insulin levels tend to be out of balance? It's how you feel. And a lot of the early symptoms are things that almost everybody that I know experiences from time to time, and that large percentages of the population experience all the time. Brain fog, like, where did I put my keys? What was your name again? What were we talking about? Exhaustion, fatigue, right? That hard to get going in the morning, hard to shut it down at night, and that blunk in the middle of the afternoon. And you know what I mean by the blunk in the middle of the afternoon? It's kind of when you start to feel like your energy's fading and it's like 4 in the afternoon. And for most people, that sends them in a rush to the candy machine or the cup of coffee or the coffee truck or whatever it is that is your thing around you. For me, it used to be that I would reach for a Diet Pepsi or a Diet Coke or another cup of strong black tea to keep me awake. I used to have this. I definitely used to have this long ago when I was young. Don't have this anymore. I don't have those crashes in the middle of the afternoon. Those are not the normal crashes that people say to me when I'm doing an intake. Oh, I just have those normal crashes in the middle of the afternoon. No, it's not normal. It's average. It's common, but it's average for 1 in 2 people to get cancer, you know? It's average for half the people to have heart disease, right? We don't want that. I don't know about you, but I don't want that, and I don't want that for you either. I don't want it for my loved ones, certainly, so I don't want it for you. So those are just some of those symptoms. So let me talk to you about some of the testing. So your doctor, almost likely, every time you go in for your annual, will test your fasting glucose. Right? And fasting glucose tells you what the level of sugar in your system is when you first wake up in the morning. And unfortunately, it's the last thing to change when you're heading for disaster. It's the last thing to change when you're heading towards diabetes. It changes way after some of these other things I'm going to tell you about. So don't rely on that fasting glucose for you to say, oh, I'm metabolically fine. I'm metabolically well. I'm not at risk, because it's certainly not true. So fasting glucose is one measure, but it's not the only one. And we're going to talk about 3 other measurements that you should be writing down and make sure that you get tested. Number 1, something called hemoglobin A1C. You might have heard me talk about it before. You might have heard of other functional health practitioners talk about. It's a really important number that unfortunately most doctors don't test unless you're diabetic, or unless they think you're heading in that direction because your glucose is heading in that, it's up above 100 now. So they start to test that maybe. Every single adult on this planet should have their hemoglobin A1C tested at some point in their early adult life, not in their later adult life, not when they're 75, but more like when they're 20, because it creeps up gently over time and it gives you an indication of what the average glucose is in your blood over a 3 to 4 month period. When you want to know that, rather than waiting for the fasting glucose to be high, because that fasting glucose, again, goes high much later. I've had people come to me who had fasting glucoses that were normal, according to the doctors, like 98, which I don't think is normal. And that's a story for another day. But when they went and had a A1C tested, not because their doctor recommended it, but because they read about it and went and asked, they got their A1C tested and it was 11 or 10 or 9, high levels, even though their fasting glucose was normal. What that meant was that that person with a A1C of like 10-ish means that on average, your glucose in your system, on average, taking into account fasting and peaks after eating, was like, 240. Would you like to know if you're trending towards that? And I'm going to teach you another way to know if you're trending towards that. But I would want to know that. This person ended up with some of the complications of diabetes, the retinopathies, the neuropathies, tingling in the fingers and toes, loss of vision, blurring vision, before ever getting a diagnosis of diabetes, never did get a diagnosis of diabetes. So those are things you want to know so you can take charge of it. Fortunately, he was very, very anxious to figure this out and to do something about it. And he took my advice and we got his A1C down to like 5.2 very quickly, quite quickly. It takes months to do this because it's an average turnover. It's damage to the red blood cells that takes 3 to 4 months to turn over. But over the course of a year, you can go from a 10 to a 5. I've seen it. I've seen it all the time in people who are dedicated and willing to do the work. So are you dedicated and willing to do the work? Or are you willing to risk the complications of pre-diabetes turning into diabetes and turning into damage to your body, your peripheral nerves, your retinas, your kidneys, and your cardiovascular system? I'm certainly not. And I don't want that for you. So that's hemoglobin A1C. The other thing that most doctors will go down to the grave fighting you before they want to do it, which is fasting insulin. If you ask your doctor, can you do me a fasting insulin? They'll go, you're not diabetic. I don't need to do that. And when you respond, yeah, but I don't want to become diabetic and I want to know if I'm trending in that direction. And they may or may not do it, but it's an easy test for you to do by going to one of the direct access labs. You can go to runmylabs.com. We have an arrangement with that company to run whatever labs you want to get done. New York is a couple, and a couple of other states are problematic, but you can always cross the border. Like you have to confiscate and go to other states to try to get your own lab test done. But this is an important thing for you to be looking at. So insulin needs to be tested, and insulin starts to creep up before these other markers. When you have a problem with overproducing insulin and developing insulin resistance, your insulin is going to go up before your fasting glucose is going up, because that insulin is controlling it, trying to manage you, trying to protect you. And it will help you to bring it down. But over time, you get resistant to that insulin. So I would say get your fasting insulin tested. And as a baseline, I like to see it between 2 and 5 at the most. So if you're above 5, you've got to start working on getting that insulin level down. Ideally, in all the functional medicine studies I've looked at, between 2 and 3 is considered ideal. I've had people tested where their fasting insulin is 20 something. That's enough insulin to handle a Coca-Cola, a case of donuts, because the body's producing so much insulin, thinking that it needs it to handle the sugar load. So if you're not ready to have that kind of high level of insulin, and I'll tell you in a minute why it's so dangerous to have it, you need to get this tested, because that high level of insulin is so unhealthy. And I've seen people get it down, within 6 months to a year, to get it into the normal range, that between 2 and 5. You got to work at it. Good health doesn't just happen. You got to be willing to do the work. And there's no magic bullets when it comes to health. You might be watching all these Black Friday, Cyber Monday sales that say, buy my supplement and everything is going to change. Buy this supplement. Take this drink before you go to bed and all your insulin problems are going to go away. Guys, it doesn't work that way. I've been in clinical practice for over 30 years. I've worked with tens of thousands of patients. The ones that get the results are the ones that are willing to do the work, to change the diet, to change the attitude, to get some sleep, do some meditation. That's all there is. There is no shortcut to this other than providing your body with what it needs to be healthy. So insulin, when it's too high, causes stiffening of the vessels that carry the blood, right? And so when those blood vessels get stiff and you've got some plaque built up, and most people do have a little bit of plaque built up if they've gotten to be the ripe old age of 60, 70, 80. Hope some people don't, but you're not going to have the same level of damage or danger of stroke or heart attack when you have nice elastic vessels. Insulin stiffens up those vessels. High levels of insulin is considered the highest level of risk for sudden death from heart failure, sudden death from heart problems in people who didn't even know they had heart problems. So get your insulin tested, get your A1C tested. And then if you have problems there, you've got to work on getting this under control. And we have lots of tools and resources. Stick with me, subscribe to the channel, follow me on Facebook or Instagram, and we're going to give you lots of great information. And it helps if you really have a serious problem to work with somebody, to work with a coach, to work with a doctor, functional medicine doctor, a nurse practitioner, someone who's trained. And I train people in nutritional endocrinology to really be able to handle this and handle it well. You owe it to yourself. You owe it to your family, worse than anything. My both family members, my mom and dad, I have a lot more family members than that, but my both parents died suddenly of what I think was a complication of insulin resistance. They had sudden heart attacks out of the blue, no history of heart disease, and they died suddenly of this. And I know, based on what I know about insulin resistance now, based on what I know about my own genetics and tendencies, that they most likely had that as a complication, because we have more genetic tendencies towards insulin resistance than we ever did towards heart disease. So I'm just guessing at that. I have a feeling that had they taken my advice and had they done the testing, or their doctors had done the testing I'm advising, that they would have had early warning signs. So I appreciate you being here to learn about this stuff, right? And to really take charge of your health. Do you want to be in that 7% of people who are metabolically healthy? Or do you want to be in the 93% that are metabolically unhealthy? Do you want to be in that 93% who's at high risk of cancer, heart disease, stroke, hypertension, diabetes? Or do you want to be in that smaller percentage who's protecting themselves? And your daily actions are what protect you. So I thank you for listening. Like I said, subscribe to the channel. If you like this video, click on the one up here. You're going to love that one. And be here with me. Be here and learn to make changes to your own diet, make changes to your life. Love yourself enough to make a difference. So I thank you so much for being here, and we will see you on the next video. This is Dr. Rita Marie. Take care.